Good afternoon. Thank you very much for your attendance this afternoon for this particular part of Pork Academy. My name is Anna Johnson. I work at Iowa State University in the Department of Animal Science. Today my colleague, Dr. Monique Pairis-Garcia, is going to be presenting our seminar topic. A little background on Dr. Monique. She graduated in 2011 with her DBM from Iowa State University, specializing in large animal production with an emphasis in pigs, and then joined my lab in 2011 and has just completed her PhD in swine welfare with the emphasis on pain management using the Sauer model. So it's my delight to turn it over to Monique. Thank you.
Thank you very much, Dr. Johnson. As you guys also know, Dr. Johnson was my co-author on this presentation, so I appreciate all of her input as well. And I appreciate you guys turning around. I'm glad that we're here and it's not too hot. It doesn't remind me of any Iowa State fair like I'm used to with the 100-degree weather. Today we're focusing on pain management, and I'm specifically talking about pain management in piglets during castration and tail docking. So when we talked about the objectives for this presentation, the first was looking at how we define pain, or how can we measure pain, focusing then on measuring pain from both a farm standpoint and a laboratory standpoint, so with research trials as well as those producers that are on farm trying to identify pain. And then really going into one of the big topics that we have right now, what are those regulatory concerns if we do want to manage pain from a drug standpoint, so provide that animal with some type of relief. Lastly, I picked a case study, so a paper that was published in 2011, and it does a really good job of not only showing how we measure pain, but what are some of our options from a drug standpoint. So pain is a really hard topic to talk about, and it's a really hard topic to look at from a research standpoint because it's what we call a subjective experience. For a human, for an animal, for any type of species, pain is going to be something that only that individual animal can understand or feel. So when we try to objectively define pain or be able to objectively say that an animal is painful or not, it can become very difficult. The first thing we need to do, though, is have a good definition of what we are identifying as painful. And for our laboratory, we use this definition from the International Association for the Study of Pain, defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. We as producers, veterinarians, animal scientists recognize that pain and suffering are going to be clinically important, and they're going to adversely affect the animal's life. Whether this pain is acute or short-term, like a castration or tail docking, or if it's chronic or long-term, such as the disease process like lameness, it's something that's not only going to affect the welfare of the animal, but also the productivity. We also know that prevention and alleviation of animal pain and suffering are very important goals, and are currently something that not only we are focusing on in the industry, but something that the social media or the consumer is focusing on as well. So when I think about painful events, I really try to categorize my pain into three areas. The first being procedures, so those would be things that we electively choose on our animals that we perform either as the vet or the producer. Management issues, which would be likelihood or going to be facilities or environments that are going to increase the likelihood of painful events to occur. It doesn't necessarily mean that that's always going to happen, but we'll see an increased incidence. And then disease. And unfortunately, not only is health a major issue from a welfare standpoint when those animals become diseased, but it also eventually usually leads to a byproduct of pain and suffering. So when we think about procedures, the most common ones we talk about are castration, tail docking, and teeth clipping. But that can also include reproductive surgeries, repairs, and so forth. Management is really going to deal with our facilities and our environments. So how are the facilities going to influence the animal itself? One area we've really been focusing on is lameness and sow, so looking at shoulder ulcers, heel erosions, fractures, and so forth. Again, that doesn't necessarily mean that one particular facility is always going to cause painful events, but we increase that likelihood. And then lastly, disease as well, so lameness from an infectious standpoint, mastitis, dystocia, and GI and respiratory disease. For the purpose of this talk, I'm only going to be talking about castration and tail docking, so that procedures. So I'm sure all of you are very familiar with castration and tail docking, but just a brief overview. Castration is the removal of testicles or destruction of that testicular formation. And there's three reasons why we castrate piglets. The first is to prevent unwanted breeding since we don't separate our sexes. The second is to reduce those not abnormal behaviors, but behaviors of fighting and aggression or sexual behaviors between animals. And lastly, and usually by far the biggest reason, is meat quality. We know that pain is associated with castration, and we've done a lot of research looking at pain itself throughout the procedure. And using some of the measures we'll talk about, we've seen that there's pain associated with individual sections. So the scrotal incision itself, the extraction of the testes, and actually what is considered to be the most painful part is the severing of the spermatic cords. Tail docking is something that we also perform quite frequently in the United States. And this is just going to be a portion of the tail being removed. It often happens with castration as well, and we know that the reasons we do this is to prevent or decrease tail biting. And really, from a larger standpoint, is to decrease that economic loss associated with that reduction in growth performance for those animals that have been tail docked, as well as be that concern from a welfare standpoint of those animals that are also being tail bitten. We've also done research looking at pain associated with that physical removal, and we have seen from a physiological and behavioral standpoint that those animals appear to be sensitive to pain. So how do we measure pain? I've talked about that we know that castration and tail docking are painful. We've done these research studies. So what have they actually collected? And from a pain standpoint, again, recognizing that it's subjective, we need to be able to get objective identify markers that are going to be able to change. So the first thing that we look at is physiological measures. So how does that animal's body respond to the process of castration or tail docking? We look at hormones, catecholamines, and the immune response as well. Behavioral measures is something that's also been used quite frequently with castration and tail docking, and we're looking at how that animal changes what we would consider its normal behavior throughout the day. So locomotion, postures, and really importantly, those maintenance behaviors. So how often is that piglet eating, drinking, socially interacting, lying down, and resting? And then lastly, performance measures. So this is going to look at the overall productivity of the animal. How does castration and tail docking influence that animal at 6 months of age? So from a physiological standpoint, the first thing we look at is hormones. And by far, ACTH, or adrenocorticotropin hormone, everybody says ACTH, and cortisol are going to be the primary hormones that we look at. And both of these hormones are going to increase with experiencing of stress. And stress can either be from fear, stress can be from a painful experience, stress can be from actually pleasurable things. So we'll see an increase in these hormones with a variety of stressful experiences. Catecholamines like norepinephrine and epinephrine, you can think of that as your fight or flight response. So these are going to be the catecholamines that are going to increase if that animal is posed to a dangerous threat. So either that animal is going to run away or that animal is going to fight. So not only can we collect the norepinephrine and epinephrine levels in the blood itself, we can also look at those indirect causes. So when you think about if you're going to have to fight a person, oftentimes you'll see an increase in heart rate, your pupils are going to dilate, your lungs are going to dilate so you can get more air. And then we also see an increase in glucose and lactate in the blood. And what all this is doing is preparing that body for the energy it needs to either run away from a far distance or fight something. The major issue with physiological measures when we talk about pain is kind of what I mentioned, is that it can increase from different things. So we know that it can increase from pain, but it can also increase from general arousal or handling. This is one of the images of our research project in which we collect a lot of blood on sows. And anybody who's snared a sow knows that if you try to do it multiple times, it kind of turns into a rodeo. So using cortisol for our sows can be difficult because just that process of handling her and snaring her is going to lead to that cortisol increase. We also talked about immune function. So again, when an animal is going to be experiencing a painful event like castration, inflammation is going to follow because you're damaging that tissue. Oftentimes with inflammation, you'll see an immediate response from the immune system, and you'll see an increase in some of these proteins like acute phase proteins and cytokines. So this is also something we can take blood on the animal and measure. And through both castration and tail docking, they've seen increases in these proteins. One thing that's really important when we think about the immune system is the immune function can actually change based on painful events. So it can actually result in greater welfare concerns if that animal is experiencing pain and then no longer able to fight off health problems or diseases that are current in the farm. Behavioral measures are our second major area and something that's really been focused on with castration and tail docking. Like I mentioned, locomotion and posture are something that we focus on. And when we're talking about castration and tail docking, these are some of the behaviors we see. So we'll see head turning towards the hindquarter, so where the incision site is. We'll see those piglets will lift their hind legs over and over and shift their weight back and forth. And we also see some movement with the tail, so either slow twitching of the tail, or as some scientists have described this tail jamming, where they'll bring the tail back and forth and kind of bring it close to their rump. Maintenance behaviors are also something we see, and we found that with castration and tail docking and painful events in general, we often see a reduction in feeding, drinking, and that activity. One area as well from a behavioral standpoint is the use of vocalization. So we've actually been able to go on farm and take recordings of the vocalizations of the pigs. And what we've seen is that when an animal's castrated or tail docked, it will have an immediate vocal response. But the frequency of the response and how loud the response is, or the high frequency calling, will change depending on the painful situation. So in processing like castration, you'll see the frequency to go up about 4,000 to 5,000, and that's much higher than what if you would do if just pick up a piglet and hold him or her. We also see an increase in calling rate. And so throughout the castration process, you'll see an increase in this calling when you make the incisions. You'll see an increase when you pull the testes out, and you'll see that highest frequency and increase when you actually cut the spermatic cords. So vocalizations have been really well for us to be able to determine those painful events. Lastly, we look at performance measures. So we really do care about how is this going to influence the productivity of the animal in the end. One thing that we'll look at is average daily gain, the feed intake of the animal, and then those end characteristics like market weight, carcass quality, and how many animals you lose. From the research so far, there's really not a lot of performance impact from castration and tail docking. So we would view castration and tail docking as an acute painful event. And usually by 4 to 5 days, that pain is no longer noticed or no longer detectable. And those animals will still have the same market weight and carcass quality as if they had any type of pain management. So from a performance standpoint, animals that are castrated without any pain measurements or pain drugs are going to be able to still have that same market weight and market quality. So how do we manage pain on farm? We recognize what pain is, how can we measure it, so what are our jobs to do? When we think about managing, there's two options: husbandry or management techniques, so how do we make those animals more comfortable, and then pharmacological, so the drugs. Today I'll only be talking about the pharmacological techniques. So the first thing we have to recognize, and hopefully you all are aware of this, is that there are no pain-relieving drugs specifically labeled or approved by the FDA for use in livestock or swine. So as a veterinarian, there is nothing that I can take from the shelf that says this is approved for pain management in pigs. With that, that means everything is going to be given in an extra label manner. Kind of a little bit of history on this. So animal drugs that we give that are intended for the use in the United States are regulated by the FDA, or Food and Drug Administration, and their branch is the Center for Veterinary Medicine. So because we don't have anything specifically approved or labeled for pain, we have to give those drugs in an extra label use manner. And extra label drug use is regulated by the Animal Medicinal Drug Use Clarification Act, also known as AMDUCA. So the good thing is we can give drugs, but we have to kind of follow certain requirements, and those requirements are given by AMDUCA. So what are our requirements? The first is that if you want to give a drug extra labelly, it has to have a valid veterinary client-patient patient relationship. So the veterinarian has to be able to be on farm, understand the herd, have a relationship with the producer, and be able to be in contact with that person if things change. Extra label use is only limited to circumstances when a threat is posed to the health of the animal, or when failure to treat that animal is going to result in suffering or death. So we cannot use drugs in an extra label manner for production. We can only use FDA-approved animal and human drugs, so we can't use any over-the-counter, and you can't use compounded drugs. And you can only use a drug if there's no approved product. So let's say in our situation, if there was a drug that was approved for pain relief, you can't use another one since you already have that. But in the United States, since we don't have anything, that rule doesn't really apply. And then lastly, that product administered under the direction of the veterinarian needs to be assigned an extended withdrawal. because we're not approved and labeled, we need to have an extended withdrawal period so we have no drug residue in our meat. There has been kind of some concerns or question if we kind of go back here that we can only use extra label use if the animal's health is threatened or that failure to treat results in suffering or death. Well, does that mean the same thing when we're talking about castration and tail docking? Because technically that's for a production purpose, right? So there's been a lot of talk on the ASV website, and actually Dr. Wagstrom over at National Pork Producers Council contacted with the FDA to really understand if we can use drugs in an extra label manner for pain management. And we did get our answer that we consider the use of analgesics and anesthetics for the purpose of alleviating pain, suffering, and discomfort in animals and as an acceptable justification. So we can, from a veterinary standpoint, be able to use drugs in an extra label manner to manage or to mitigate pain. So what are our options for drugs? We have three areas here, really. The first is local anesthetics, which you're probably most familiar with, lidocaine. General anesthetics, which are going to be our gas anesthetics like CO2 or isoflurane. And then analgesics. And there's a lot of drugs that can be analgesics, and the one area I'm going to focus on is NSAIDs, or non-steroidal anti-inflammatory drugs. So, local anesthetics are the most commonly used pain-relieving drug in food animal medicine, and how they essentially work is they produce that loss of sensation by no longer allowing those impulses to go through the nerve. So this can be most similar to when you get a cavity filled at the dentist. You get that form of lidocaine or bupivacaine put in there, and essentially you're preventing and blocking those nerve impulses from telling your brain that it's painful. Lidocaine is by far the most commonly used one, and the biggest disadvantage here is it's short-acting. So lidocaine only works for about an hour, and then that animal is going to experience pain or feel pain. One thing that I kind of want to just mention is lidocaine is the most commonly suggested drug for pain relief, but it's not actually approved for veterinary use. So the only way that you could use lidocaine is if you use the human-approved lidocaine, so the lidocaine that's actually made for humans, because we don't have it approved for animals. So that's something that your veterinarian needs to just make sure they keep in mind. But lidocaine can be used. So we also have general anesthetics, and general anesthetics are going to work by just that loss of sensation and unconsciousness. So this is going to be a situation like you go into surgery, or for some that are using CO2 for euthanasia, you're actually putting the animal in a state of unconsciousness where they cannot perceive pain sensation. This is going to suppress cerebral activity, and some gases that have been used include CO2, isoflurane, and sevoflurane. And again, similar with our local anesthetics, the major issue here is it's only really going to cause that pain relief during the process that it's given. So once that animal no longer has the CO2 or the iso running through it, it's going to experience that byproduct of pain. Our last area is going to be our analgesics, or our NSAIDs. And those that you may be familiar with include flunixin or banamine, meloxicam, and ketoprofen. And the advantage of these drugs is that unlike our anesthetics, they're longer acting. So we can actually give a drug and see a longer effect in it. But unlike that local anesthesia, it's not going to be effective immediately. So if I gave you an aspirin, it might take 20 minutes before your headache goes away, versus if I somehow could get a local anesthetic into your brain, it would go away immediately. So with our analgesics, they're longer acting, but they're not going to be able to be as effective immediately. And by far what we found is the best approach to pain management for castration and tail docking is going to be that multimodal, or using both types of drugs. So here is just a case study that I'll end with, and this is pain relief specifically for castration. The title of this presentation is Effect of Local Anesthesia and or Analgesia on Pain Responses Induced by Piglet Castration. So in this particular study, they had 141 litters, and in each litter they used 4 male piglets. And for each one of those male piglets, they underwent one treatment. The first being they were just castrated without anything. The second, they were castrated and then given meloxicam after they were cut. They were castrated and then given lidocaine prior to being cut, or they were given lidocaine, castrated, and then given meloxicam. So here we have no drugs at all. We have an analgesic that's going to be longer effective, but it's not going to work immediately. Lidocaine, which is going to be that short effective right when the castration's happening, and then both. So we had both physiological measures and behavioral measures in this study. This is looking at vocalization. So on our x-axis, we have our treatment. So remember, castration, just given meloxicam, just given lidocaine, and given both. And this is just our decibels, so how high those calls went. We find that piglets that were castrated with lidocaine and meloxicam, there we go. Piglets castrated with the lidocaine had fewer calls or a lower intensity than piglets castrated without lidocaine. So this is our lidocaine group, and they only had a frequency of about 104 decibels compared to those that did not get that local anesthesia, were about 110, 112. So from a behavioral standpoint, administering that lidocaine did decrease the intensity of those calls during the castration process. We also looked at the ranking of resistant movements. So this is going to be how much that piglet fought during the castration process, how often those legs were going up, or it was hard for the actual producer to castrate. Here we have a ranking. So a ranking of 1 would be the most resistant movements that animal was really fighting. And a resistance of a 4, ranking of a 4 is going to be the least. Again, we have the same treatments here. So these are our lidocaine group, and this is our castration and just meloxicam. So you see when we look at the rankings of 1, those that were given lidocaine had the least amount of the most resistant movements compared to those with castration, castration alone, and then castration without lidocaine. So again, those animals that were castrated without lidocaine showed more resistant movements. And then lastly, this group was looking at ear and skin temperature, and this was the day after castration. So the one thing they did find was that those animals that received the lidocaine had a lower ear temperature than those animals that did not receive the lidocaine, and skin temperature was not different. So the production measures were also collected. They did not see any differences with production, so mean weight on castration day when those animals were castrated were not different. They didn't see any difference in weight gain in those animals, and the morbidity and mortality was not different between the treatments. So the case summary here is that lidocaine did reduce pain during castration, and meloxicam did reduce pain after castration as well. There was no treatment effects on skin temperature, weight gain, morbidity, or mortality. And this was actually a paper conducted in Sweden, and one of the things they wanted to find out is if the herdsmen could actually effectively inject the lidocaine into the testicles, and the herdsmen were able to effectively administer that local anesthesia. So that was just the ending of the case study, and my take-home points here, and I hope I'm okay on time, is that pain associated with castration and tail docking is a current welfare issue on farm. It's something we're dealing with. We know that it's associated with pain. Pain relief may be conducted using either anesthetics, analgesics, or a combination of both. And the use of these drugs can be performed in an extra-label manner. And lastly, from the research, it appears that a multimodal drug approach, so using both a local or a general anesthesia and an analgesic, is going to be the most effective for pain relief and castration and tail docking.